Hi, this is Shan Mantri. I'm a GP on the BAME CCG board and clinical lead for the Map of Medicine project. In this video I wanted to give you an overview of Map of Medicine, what it is, what are the components and how it can help. And there will be more videos going in more detail on specific aspects of Map of Medicine, but I thought it would be helpful just to explain the system to you. Map of Medicine, very simply, is an information store. It is an information store that can be accessed at your practice computer, and it can also be accessed through the web. The advantage of this store is that because it's web-based, we can update it centrally, and so when you access it, you always know that you've got the right information at the right time. The system has information in the form of maps, which can be both clinical and non-clinical, but it also has referral forms. One of the great positives of the system is that it can integrate into both System 1 and very soon EMIS Web, which means that the forms it stores can be auto-filled with details from your practice system. So, as I said, Map of Medicine is three main components. The first thing is maps, which, as I said, can be both clinical and non-clinical. So maps takes the form of things like this. So this is a clinical map, which is a map that we've done with the gastroenterologist at the RUH, talking about abnormal liver function tests. And it's pretty much a case of a flowchart. So we have a condition here, and it takes you through and tells you what you should and shouldn't do. You have these little eyes, which if you press on, gives you more information. It allows you to have web links and stored content, such as PDFs. And the advantage of all this stuff is that you can search for it, and you've got a little search box here which you can search for this information. So here is a very clinical map that we've done. If we move to this map, which is a map from Emerson's Green, this is more of an administrative function. So this map has different things that Emerson's Green does, and if I click on, say, endoscopy, it gives me details as to what procedures they do at Emerson's Green, and here's some attached forms. And if I click on here, which is their exclusion criteria, there we are, it gives me a PDF copy of their form. So the first map, the abnormal liver function test, is something that probably GPs and nurse practitioners will be likely using. The second map, and maps like this, are things that more of an administrator, secretary may be using more of. So there's no limit really as to the type of information that we can put on there. And as I said, one of the advantages of the system is the ability to search. So if I click on the search box and type in LFT and return, it's picked up abnormal liver function test, which if I click on will get us back to our abnormal liver function test map. I'll be talking about maps in a lot more detail in another video, but very simply that's what maps is. The second component of Map of Medicine are the forms, and essentially, if I bring up the directory, these are Word forms that can be pre-populated. So here we have a directory, and these are all the forms that we've currently got on the system, and we've covered most of the forms that we use in BAMES on a regular basis. and the idea being that as a clinician or non-clinician, you can double click on these forms and it pulls the necessary information such as name, address, NHS number from the clinical system and produces a form that you can then fill in. The advantage of map referrals or these forms is not only will it populate the forms, it will also save the completed form within the practice software under the patient's details, which from an audit perspective and a safety perspective, it's quite important, so that if a referral is done, there is an audit trail to say who did it and when it was done. Again, there will be a video on map referrals where I'll go in a lot more detail, but essentially that is what map referrals is. It's referral forms. The final component to Mapper Medicine is Sidebar, and here's Sidebar. And very simply, Sidebar is just your interface into both map referrals and regular maps. It's a little widget which you can make a little bit smaller or bigger. I can bring it down by clicking there. I can make it bigger by clicking that back on there, and I can move it around. If I minimize it, I can move it up to the top and make it a bit bigger again. And that's Sidebar. Now, Sidebar is something that should be being installed or has already been installed on your practice software. So if it is, you can get on and use it if you've got your login. But again, I will talk about the installation of Sidebar and logging in on another video. For those of you that don't have Sidebar and perhaps are an EMIS practice that we've not been able to install it yet, you can still access at least the maps part of Mapper Medicine through a web browser. The maps I've just shown you I've been using through Google Chrome, but you can use any web browser. And during the maps video I will talk to you about how to log in to the system using a web browser. And that is really what Mapper Medicine is. And hopefully that video was of help. It was a very brief overview. I would encourage you to have a look at some of the other videos that will go into a bit more detail about some of the different things and different components.